Let's now speak to Laura Otieno from Kisumu County. Good morning, Laura. What's the situation like with the nurses in the hospitals of Kisumu County?
Well, good morning, Sam. And the nurses have made true their word of going on strike starting today. So about 800 nurses from the entire county are currently gathering themselves in preparation for a grand march. They will be moving around the streets of Kisumu basically to protest the county government's failure to honor their return to work formula terms, where they were supposed to be given nursing allowances and uniform allowances dating back to June 2018. So if maybe my cameraman could pan to his right, and then you will be able to see a clear picture of what exactly is going on in terms of the strike of nurses today. So the nurses are currently gathering at the Jomo Kenyatta sports ground, and what you are about to see there is the interim nurses center. Well, he's trying to pan, and then we will show you exactly what is happening there under a tree, so that's why we cannot quite get a clear picture. But right now they're gathering themselves there to protest the county government's failure to honor their return to work formula. Now, looking at as it was agreed in that formula, the allowances were supposed to be paid as from June, but then we were looking at the Kisumu County's budget for the year 2018-2019, and the 9.2 billion shillings budget had allocated about 3.1 billion shillings to the health department. And now breaking that down, 3 billion shillings was the allocation, of course, to the health department. 2 billion shillings was to go to the personnel in the health department. Now that would have been quite a rough figure, not enough to really cater for the nurses' allowances, considering that there are 800 of them in the county. But then also the universal health coverage pilot that was being rolled out in Kisumu County, where more personnel had to be hired, and other activities revolving around UHC had to be carried out. So a bulk of the money was spent towards realization, or rather towards making a success of the UHC pilot program that was officially launched in December last year by the president here in Kisumu County. So as it stands right now, maybe we will be able to get that picture later. Where we are standing is where the nurses are gathering. Of course, they're waiting for their members, because some of them are traveling from as far as Mohoroni, as far from Seme, and they're saying that they are going to cause a total paralysis of nursing services across all public hospitals and across all public health facilities, similar to what they did for 5 months in 2017. So it's a wait-and-see game, because even the supplementary budget for Kisumu County this year is yet to be tabled at the County Assembly, but then we will be looking into details of that budget as soon as it is tabled in the County Assembly, to see if there is any allocation that is made towards maybe honoring the allowances of the nurses. But as it stands, the nurses will be sitting at the waiting bench, and of course in the center of all this are the patients and residents of Kisumu County who are supposed to benefit from the UHC program, where some of them received their cards about 2 weeks ago, the UHC cards, and they're supposed to receive free medical services as soon as they enter into any public health facility or public hospitals. And of course, today being World Cancer Day, of course, looking at that backdrop, nursing services are quite essential, especially in cancer screening and things like that. But then the nurses have withdrawn their services, so of course that is also under jeopardy. So we'll be waiting to see what happens in the course of the day, how events will be unfolding, and if the county government is going to budge, or the national government will have an intervention to see that the nurses' strike is called off, or rather is over, Sam.
All right, Laura, you talk of a game of wait and see. I'm just wondering, what has the government of Kisumu been doing in as far as this conversation is concerned? Because you've expressed some of the reasons of how expensive it is to run the health department. But what have they been doing about it? Because they knew it was coming to this.
Well, Sam, the county government has been quiet to the media in terms of the nurses' strike, but the nurses are saying that they have been trying to engage the county government, who have been giving them promises of remitting their allowances. They have been saying that issues with budgeting. But then, as I said earlier, we have looked into the budget of the 2018-2019 financial year, and the allocation made to the health department was 3 billion out of the 9.2 billion budget of the county. But then a chunk of that money, arguably, according to officials from the health department, say it went to the implementation of the UHC pilot, which was prioritized. But then nurses are saying that until their allowances are remitted, then even the success of that UHC program is under jeopardy. So maybe, just maybe, the supplementary budget will be catering for the nurses' allowances, but then that is something we have to wait and see until that budget is tabled in the county assembly, because the county government is so far mum on this issue to the media, but the nurses claim that the county government has promised that they will pay. So until the promise is fulfilled, or rather until we see the budget where nurses' allowances have been factored in, then it will be a game of spinning the wheels, Sam.